The closure of schools locally has been maintained for almost 3 months as part of the measures to limit the spread of COVID-19. As a result, thousands of children are forced to remain home. This means they no longer have that sense of structure and stimulation that is provided by that environment and now have less opportunity to be with their friends and get that social support that is essential for good mental well-being. Even though the education system has taken on remote learning as a temporary fix to keep students involved while at home, adjusting to this new norm psychologically is quite challenging amid the numerous distractions. This is according to Will Campbell, a counseling psychologist who spoke with Nightly News on Tuesday.
This disruption is also felt by children. They no longer have their usual routines. They miss their friends. They are forced to stay, they can't go out like they used to. They're forced to stay inside. So this is a disruption for them in that way. In addition to that, these children also are faced with the fear and the uncertainty that is imposed on us by the spread of this epidemic, of this virus. And so they're watching the news just like we are, and they're hearing the conversation, and they're hearing that people are dying.
He noted that children are likely to be experiencing worry, anxiety, and fear, and this can include the types of fears that are very similar to those experienced by adults, such as fear of dying, a fear of their relatives dying, or a fear of what it means to receive medical treatment. He pointed out that while fear and anxiety in some cases may be filtered down from parents to children, it is important for parents to model positive energies.
As adults, we also need to model confidence. If we are frantic, if we are, if we are scared, if we appear scared and frightened by all this, then we transmit those emotions to children as well. And so we have to model the confidence that we want our children to feel. Another thing that we can do is to reintroduce some kind of routine.
Underscoring the importance of reintroducing routine, Campbell explained that setting aside specific times to review textbooks or engage in reading should not exempt time to play, as they all are stress-relieving activities. Moreover, the psychologist opined that parents can also monitor children's access to the news and the internet, which is flooded with stressful information about the disease.
Can contribute to depression and anxiety and other mental illnesses. So we want to be careful about what we watch, all of us, and particularly our children, who are less able than the typical adult to moderate their own mood and to, move past these difficult messages. You want to be careful about the kind of shows that they watch. And there are parental controls that we can install on these devices or activate on these devices so that there are certain things that they are not exposed to. In addition to that, you as a parent have to monitor it.
Temika Rodney reporting for the HGP Nightly News.